All right. Yeah, I have a feeling we're going to resolve this tonight. I don't know why I think that, but I just think that's the case. So we have a viewer who wants to talk about MNsure, and this viewer is quite unhappy about the status of things. I think we can probably summarize the question and just simply say that he doesn't think MNsure has worked, and he's wondering what the legislature, if anything, is going to do about that. So who wants to take a run at that first? Senator Han, I think you introduced the topic, so maybe we'll pick on you.
Well, yes, I think we are concerned about MNsure from our side. Obviously, many of us didn't support the bill. We had other ideas at the time, and but it is the law. But there's no question that the implementation of the MNsure exchange has been very problematic. It still is not working. There have been, I don't know, a couple 100,000, 300,000 people who have had to give up their insurance that they prefer to try something else, some of which they don't prefer. The costs, the premium costs have gone up in many cases. The other side likes to say we have lower premium costs compared to other states, but not compared to where we were before we had the law. So we think there are things that should be addressed. We think the governance of the MNsure exchange needs to be looked at. There are ideas that we had when the law was passed that were not adopted that have to do with the governance structure, with the powers of the governing board, whether or not they ought to do active purchasing, for example, which in our opinion just reduces choices people have. But there are things that are very fundamentally flawed with this law, and we're concerned that we are losing the ability to control health care and health insurance in this state, that it's all going to go to Washington, and we're going to have to go and beg them for waivers and other things in the future to do things that are very commonsensical. So we are concerned. We want to try to rein that in and bring control of health care back to Minnesota.
MNsure, Representative Keeson?
So, well, and I sympathize with the person if they've had trouble getting through the process, and there have been too many people over the last several months that have had that experience with the website. I mean, the good news on that is that right now the wait times are drastically reduced. We're down to about a minute wait time at the most. We have over 98% of people now getting through the process on their first time through, so people are making it through the MNsure process and getting to insurance, and so I think those improvements are a good thing. More than that, the reality is over 100,000 people now have actually gotten insurance through the exchange. A lot more have gotten insurance in the private market at these lower premiums, the lowest in the country, as a matter of fact, at these lower premiums because they can contract directly, but the deals negotiated with the insurance companies in the MNsure program are also available to people buying it outside the MNsure program. So a lot, even more than that, are getting the benefit of these lower premiums that were the result of this competition. I mean, that's really what the exchange is about, transparency and competition. And then there's the expansion of Medicaid that had happened as well. So another couple 100,000 people are getting coverage today that didn't have coverage before. So, at the end of the day, I think what our goal ought to be, and I don't know that there's the action we need to take this year to fix it, because I think that the MNsure board and the people working there are actually fixing the processes. But at the end of the day, what we need to do is make sure that the direction we're heading with this is continuing to expand access for people. And the worst thing we could do, from my perspective, is to go back to the status quo, which is what we had before. And everybody's claim, the Republicans like to claim that this was a magnificent system that we had in Minnesota before. And we did have a nation-leading. I still think we have a nation-leading medical system because of the hard work of our providers out there, the fact that we have a healthy population, and we're continuing to make strides in that. I saw obesity rates for children, came down once again. So there's a lot of good things happening in healthcare right now in this state. But the fact of the matter is, before, people with pre-existing conditions couldn't get affordable coverage. And one thing we did in MNsure is make sure that happened. People had annual and lifetime limits. The Republicans, at least in Washington, D.C., want to go back on that, as well as the pre-existing conditions. Going back to the system that we had in 2008 and 2009, when a lot of people in this state couldn't have access to insurance, or if they had access to insurance, it was not meaningful insurance because they weren't paying. They were paying premiums for insurance that they couldn't access because of huge deductibles, et cetera. I don't think people want to go back to that old system. So my sense is we should help people get through the system, and to the extent we need long-term to continue to make changes, we should continue to improve the system. But nothing's perfect overnight, and I think we're moving in the right direction.
Can I just jump in and just say I think, from my perspective, I think Minnesotans want to go back to a market-based system, and this clearly isn't. We have spent $160 million on this project. And to date, there is no evidence that anyone today is being insured that wasn't insured before. We've forced a lot of people to change their insurance, but in many cases to buy insurance that they didn't want. You know, you've got elderly men buying insurance that covers maternity stuff, for example. You don't need to do that.
Well, in fact, I think
so
we should have people. I mean, unless you only want people, the women that are pregnancy age, to pay the full cost of having to have kids, which is what you're arguing for. And I don't disagree. I think we should all have a vested interest in making sure we have healthy before childbirth and during childbirth and raising those kids.
But
and I think that's a difference of philosophy that we have.
You can get it, in our opinion, you can get better savings, better efficiencies by employing market choices rather than limiting choices and having bureaucrats and government people decide what those choices look like. And I think that's the great failure. But it is the law. That's what Obamacare is. Our concern is that we have to live with it for the time being, but we ought to be working at trying to make sure we have the ability to make choices in Minnesota. We ought to be pushing back on the federal government saying, don't do stuff to us that we don't agree with. And there's lots of things, I think, on both sides of the aisle that we think don't make sense with this law, but we've lost control. We need to get it back.
Senator Bach?
Well, I think the reality is this is a federal law, and it's not going to be repealed. So in Minnesota, we had two choices. We either could default and let the federal government write our exchange, or we here in Minnesota could develop our own exchange. There was broad support to develop our own exchange. Even the Minnesota Chamber of Commerce, who oftentimes I and Democrats probably don't agree with on things, thought it was best for Minnesota to do its own exchange. We did that. There have been plenty of bumps in the road, but this is a big change. And big changes, especially, and most of the problems have been around technology and the implementation of it, and we're making tremendous progress there. And you know, I think this is a point in time we will look back on and say, you know what, it was the right thing to do. I expect everybody's going to have health insurance. And you know, I know when Medicare was passed during the Lyndon Johnson days of the Great Society, there was a lot of anxiety about that too. But you know, no one today is calling for the repeal of Medicare. And it's going to take a little while, I think, to iron some of the bugs out, but I do think it's the right policy, not only for our state, but for our country.
I think, you know, this system is more flawed, I think, and we're finding out every day. Just yesterday, the MNsure board put out their projections for the number of people going into the private pay portion of MNsure. Their projections originally back in, I think it was March of 2013, were about 160,000 people that they suspected would be going in. They revised that lower last October or November, and now that number is right around 50,000. So it's less than a third of what they originally thought were going to go in. And the real problem here, and it's going to cause a huge problem for the rate increase that's coming around the corner, is that the population that's going in doesn't have high enough numbers of the young, healthy people that we need to maintain the rates that have been put in place. So. And I think we're lagging behind what they projected when they set these rates by somewhere in the neighborhood of 15 to 20% less of those younger, healthy people going into the MNsure system than what we need to maintain those kinds of rates. So unless we do something, unless something changes, we're going to see huge rate increases this fall. And you know, frankly, people are paying more for health insurance today through MNsure than they were before. And as Senator Hand said, there's no evidence yet that anybody has obtained insurance through MNsure that didn't have it before. So yes, there are some subsidies available, and yes, people are getting that, but ultimately people are unhappy with MNsure. And I think there were some polling numbers out earlier this week that said that fully half of Minnesotans don't think that this is a better system for Minnesota. And I agree. I'm not suggesting that we should necessarily repeal this, but we can't put our heads in the sand and pretend like it's going to get better without us doing something about it.
That's the first time I've heard that.
We made news tonight.
There we go. What's the idea of, instead of, if you don't want to repeal it, what do you want to do?
Well, I mean, there's a lot of things we can do to fix it, but you know, we offered over 100 amendments in the House that were rejected. We had about 8, I think, that were accepted, but over 100 amendments from House Republicans through the process that were rejected. I think there's a lot of things we can do to change the makeup of the board as far as getting people that have that insurance experience involved in the process. But really, it's a real problem. We don't have the populations going in, and we need to address that.
Well, I think, to answer your question, I think there are a lot of people who think we ought to be block granting Medicaid, for example, dollars, instead of having the federal government define Medicaid. And as a person who tried to manage that budget for a couple of years, let me tell you, you get your hands tied. You can't deal with over half the budget when you have to deal with the Medicaid laws as the federal government makes. So my suggestion would be get a block grant from the federal government. Let us manage whatever the new law is to the way we want to do it. And if we were able to do that, I think we could make some decisions about how to do this more effectively, how to do it more cheaply, how to incorporate some market choices into this thing. That's what we need to have.
And back to your point too about not repealing this. I mean, certainly I think that we could put a market-based solution in place that would be much better than what we have there, and that would ensure that we'd have the lower rates that I think Minnesotans are expecting. But there's going to be a lot of disappointment because expectations are being set that we're going to have the lowest rates in the country and that people are going to get low coverage or low-cost health coverage. And unfortunately, if the current trends continue with the populations that are going in, we're not going to have that, and people are going to be very disappointed. So would I repeal it? Yes, but unfortunately, we've got the Affordable Care Act in place that's mandating that we do this. So,
Speaker Thiessen, I'll give you the last word on this one if you have anything.
Well, the market-based solution is the same solution the Republicans have been talking about for 20 years. And if you go back to 2000, probably what we had in place before MNsure, I mean, MNsure itself is a marketplace. That's the whole idea. And it didn't work. So I'm looking, just to say market-based solution is a nice slogan, but it doesn't really answer the question.
Well, we'll have a chance to discuss that in the weeks ahead, I think.